My name is Dr. Priscilla Kashero. I am the medical superintendent of this facility, and I'm also a pediatrician by profession. So what happens when we talk about this fund is the hospital is at liberty to use money at source. Basically, whatever we generate, we are at liberty of using that money. And that never used to happen before. I have interacted with USAID Hero since I became the medical superintendent twice. The first interaction was I attended a training. It was a sensitization on universal health coverage, the laws, especially with the FIF Act and the Social Hospital Insurance Act. I learned a lot on that training. I think majority of us were confused before between financing fund, and that was the initial entry point where I learned about FIF and what it's all about and how beneficial it will be to our facilities. The beauty about this fund is we make our own budget according to our needs, and we can spend our money as per our collection. I'll give an example of this area. This area has very inconsistent water supply, very inconsistent electricity supply. So if I need to buy water, sometimes like I give an example, for the past 2 days, we've not had electricity for almost more than 24 hours. That means fuel. I had to fuel the generator with more than 200 liters. You can imagine if I did not have money at source. I have to call someone, let's say in the department, for them to organize for me fuel. But since I'm the AIE holder, I can make, of course we had a budget that we catered for fuel, but I can make the solid decision that we go for fuel these liters and the hospital runs without electricity for that time. We get supplies from the county, but sometimes these supplies do not meet our targets. I'll give an example of drugs. This year, we got 47% what we ordered from KEMSA. 47% has not even reached half of the drugs. Now, this hospital has to run, especially with emergency drugs, nebulizing solutions. We need drugs for convulsions for babies. We did not get it from the KEMSA supply. What do? We have to chip in using this fund so that we cover up what lacked from the supply from the county. So the fund is able to come and supplement where the basic needs are not met by the county. So we have two different types of payments. We have patients who are registered with the National Insurance Fund, and we have patients who pay cash. Majority of our population, I don't know why they prefer the cash way. I think maybe we've not done enough community sensitization about the HIF and the SHA that is coming in, but majority of our patients actually pay cash. Since the fund was introduced, I think it has been very helpful to the facility. So to start with, this fund has been very helpful in commodities. We normally receive commodities from the county, and we are very grateful, both pharmaceuticals and non-pharmaceuticals. But there are times that the commodities are not enough for the growing population of this place. Lab is a very important component in health systems. Every patient who walks into a facility needs to be investigated fully. Now, the commodities of the lab reagents, okay? We are also able to bridge the gap, that at least we make sure in a full year there is no lab service that is missed here. When we come to human resource, this fund has been able to bridge a gap that has not been met by the county. Majority of the employees, especially the big cadres, are employed by the county government. But we have both the skilled and the casual. The cleaners of these facilities are fully paid for through the fund. So we have on average, the contracted employees, all of them amount to around 113. And these include cleaners, cooks, clerks, nurses, clinical officers, okay? Their salaries are fully paid by the fund. So there was one of the pharmacy technician who was seconded here through Stawisha. but the contract came to an end. He was a very well performing staff. Apart from us seeing the need, we retained him using the fund. So this is one of the members who is being paid his salary through the fund. We never used to have an NBU unit, and we had started receiving a lot of patients that are born either premature or are born before the day, their weights are little. We have to accommodate them till they reach 1.8 kilos. So we didn't have a room to place. In the pediatric ward, there is an NBU unit where we accommodate the smaller babies until they are ready to go home. It was fully partitioned by the SHIF fund. I was in a capacity building meeting, fully funded and supported by USAID Hero, and it was FIF review meeting for the achievements and learning from each other of the best practices that we have achieved in the past financial year. I learned a lot. There is a gap that we have identified in this facility. This facility has grown. This facility started as a health center. Now we are level 4. So our needs are growing. We have 2 surgeons. We have 2 orthopedic surgeons. We have 3 gynecologists. We have 2 pediatricians. We just received a urologist today. We have 1 working theater. So my one goal this year is to open a second theater. I already have the budget. I already have what it takes to open this second theater. So it's just to work on a plan how I can open. The infrastructure is there, the room is there, but it's just an empty room. The county brought us a new machine, an aesthetic machine is there, the lamp is there. I need to look for more human resource. I need to look for equipment. We open a second theater.